Hello, today I'm going to be discussing which foods trigger or worsen multiple sclerosis symptoms. If we haven't met yet, my name is Pam Bartha and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. How can I be an authority on this topic? Well, I myself was diagnosed with multiple sclerosis 29 years ago, and I'm happy to share with you that with what I have learned, I have been able to live an MS-free life for the past, it's 30 years now. And I've had the amazing privilege to coach over 600 wellness champions in their recovery from chronic disease. And most of the students that I work with, they have been diagnosed with multiple sclerosis. I do attract a lot of people that suffer with MS because that was my history, that was my story, that's what I recovered from. So because we have worked with such a large cohort of hundreds of wellness champions, and we have had such amazing successes seen in their, because of their hard work and because of them implementing what I'm going to be sharing with you today, it has given them their life back. And so that's why I can talk about this. So there are so many different diets out there. Yes, before I get started, I just want to acknowledge you guys. Hi, Rudy. Hi, Roberta. Hi, Tina. Hi, Marlene. So please interact with me. Please, if I say something that you agree with, give me a thumbs up or hearts. I love it. Thank you so much, because right now I'm just looking at my computer and I cannot see your beautiful faces. But going back to figuring out what will make us feel worse, what will make our symptoms worse and possibly trigger symptoms, we have to really take a step back and kind of look at, well, number one, many of you have tried many different diets. So back in the day when I was first diagnosed with multiple sclerosis, there was the Roy Swank low-fat diet. And I followed that. And I found it didn't really make a difference. Then I also followed a Candida diet, and I found that was helpful, more helpful, because it's just lower carb. Then nowadays we have vegetarian and vegan versus eating low carb. So or else we have this autoimmune paleo diet. So how are we supposed to know which kind of foods are going to make us feel worse and which kind of foods are going to make us feel better? The key is you have to understand what is causing your symptoms. All right, that's key. If you know what the causes of your symptoms, then you will understand which types of foods will aggravate those, whatever the cause is, it'll make it more active, or which one of the foods will actually make the cause less active, less inflammation, and feeling better. If you've watched any of my videos, you know that I talk about how multiple sclerosis and all chronic disease is caused by infections in the body. I just want to stop for a minute and say that what I'm going to share with you, this is a little secret. All of these triggers, they're not just for multiple sclerosis. They are for anyone that's dealing with symptoms of maybe pre-autoimmune, or maybe you have an autoimmune disease label. These foods and food-like substances, they will trigger our symptoms. So going back to, all the confusion of like which type of eating plan, like what is going to be most helpful to really decrease these symptoms and not make them worse. The infection part. So number one, I have put together a resource for you, and it is on my website, livediseasefree.com/MS-infections. Again, livediseasefree.com/MS-infections with an S at the end. When you go to that page, I put together just a small sample of many, many studies that link multiple sclerosis to chronic infections in the body. And what we have learned, because we work with such a large cohort of people, we're really finding that parasites are probably the biggest type of infection that's causing the biggest brunt of the infections. That is key to know, because if you know that you're dealing with a lot of parasites and a lot of fungus and possibly bacteria, then you want to think, okay, well, what will make them more active in my body? What will cause them to, for them to grow more and my immune system to fight them more, for me to have more inflammation? Those are the kinds of things we're going to talk about today. So although there are many different diets and a lot of them have some benefits, definitely some benefits, if you want to get the biggest benefit from your eating plan, and if you want to avoid the foods that will make your symptoms worse, you have to understand the cause. So I'm talking about not just multiple sclerosis, but all of the neurodegenerative diseases, all of them, like whether it's MS, ALS, PLS, Parkinson's, etc. All of those conditions, including cancer and all autoimmune, there is this underlying main cause of infection. Most of these infections, as I said, they thrive on carbohydrates. So what kind of foods will make our symptoms worse? What will make the inflammation worse in our body? Well, number one, sugars. That is the worst one that we could eat. So whether we're having fruit juice or whether we're having pop or whether we're eating baked goods that are really high in processed sugars, anything that's high in processed sugars is going to feed those infections. It's like putting gas on a fire, and it will make our symptoms worse. All right, and this is not just MS, but I'm just telling you, it's all across the board. So number one, highly processed sugar type food-like substances definitely will. So we have to really decrease the sugars in our eating plan. And just understand that these infections don't care where the sugar comes from. If you're having organic maple syrup, it's sugar. It still is sugar, and it will feed the infections just the same. Thank you, you guys get it. And then also like organic honey. So again, a little bit of maple syrup, a little bit of honey is a healthy thing, especially if you have unpasteurized honey, etc. If you are in balance in your body, if you don't have these infections and you don't have these awful symptoms, if you don't have a disease label. So we have to first, stop feeding them as we do in our system, the Live Disease-Free system, and then we treat them. And then when you've been disease-free for a long period of time, then you can start to test things and bring back in healthy things, like maybe a little bit of organic maple syrup or a little bit of honey, etc. But remember that if you eat a banana, which could have about 5 teaspoons of sugar, it doesn't matter where the sugar comes from. When you have parasites, fungus, and bacteria, the bad pathogenic forms, especially of the bacteria, they will make your symptoms worse. All right, all of whether it's nerve symptoms or whether it's gut symptoms or whether it's just your head symptoms of the foggy head, depression, anxiety, all of that will get worse. And again, it doesn't matter if it's from fruit or if it's from processed high fructose corn syrup, it will all feed the infections. So number one, sugar. Make sure to get rid of all the sugar from your eating plan in the recovery phase for sure. Number two is the grains. So this is gluten grains and other grains. We take out all the grains. Grains are complex, they can be complex carbohydrates. Usually, like when we have pastas and cereals and breads, we've ground it up, right? We've kind of pre-digested it. Our blood sugar will go up quicker. So the key is that there's 2 issues here. Number one, when we eat a lot of grains, they break down into what in our body? Do you guys know? Let me see. You guys know what? Type in if you know what they break down. What do the grains break down in our body? What do they break down to? It takes a second here for it to come through. Yes, they break down into sugar in our blood. So when we have, going back to the original sugar, when we have processed, pre-digested sugar from pop and juice and cookies and things like that, our blood sugar rises very quickly. And with the high blood sugar throughout the body, it will feed the infection wherever it is, whether it's in different organs or lungs, etc., anywhere in the body. So it'll feed the infection throughout their body, whether it's in our joints, etc. And then even when we do a lot of carbohydrates, let's say the grains, then we end up with it breaking down and it increases our blood sugar again. So we want to, when we're recovering from chronic disease, to avoid these triggers, these flare up of symptoms, we want to keep our blood sugar steady. So we want to decrease the carbs, we want to decrease the sugars tremendously to the point where our blood sugar remains quite stable, and we're actually changing our body to burn more fat versus sugars and carbohydrates. So that is key. And then the second thing about the grains is gluten. there's a study that found that with multiple sclerosis, but also we know that people that have celiac disease, they can have many other diseases too, that there's a higher incidence of celiac disease with multiple sclerosis. And celiac disease is something you have to take very, very seriously. You can have even early death. You can have so much, like, different types of horrible, horrible symptoms. It's something to take very seriously. So gluten, and this is where, you know, there's a lot of different theories. One that I found from a study is that in Holland, they found that the gluten is a protein. And gluten, that protein, it is very, very similar to a protein that Candida uses to bind to the lining of our intestines. So if we have a lot of fungal overgrowth, which has really been linked also with MS, then our body can mistakenly see that protein of gluten as the enemy, right, as the Candida protein. So that is a big problem. And there are other theories out there as to what it is. It doesn't matter. We know we're sensitive to gluten. So it's very important to take gluten out of the diet. So the grains are going out because, number one, of the gluten, and that would include things like rye, barley, wheat, and a few other different varieties, but also the other grains. So things like quinoa, which is a healthy grain, but if you're not digesting it properly because we have the inflammation in the gut and we're not releasing the digestive enzymes that we should, and then that food ends up going, the grains end up going down to where the infections are, feeding them, it's not good, right? So that's why there's several reasons why we're taking the grains out. All the grains. This is chia seeds and flaxseed and all of that. So to recover from chronic disease, it takes discipline and it takes pouring your heart into it, and it's worth it. We've had miraculous, I share at the end of pretty much every video, I'm sharing successes. I'm going to share that with you today, life-changing successes. So again, get the sugars out of your diet. Number two, go grain-free. And that includes things like corn too. So I know that corn does not have gluten in it, but make sure you're corn-free and all those other grains I mentioned for those various reasons. Number three is getting rid of the starchy vegetables. So the starchy vegetables, again, they have a higher carbohydrate content. So when they break down, it's going to be more sugar in your blood, which is going to feed the infections throughout your entire body, including in your intestines. So we don't eat, while we're recovering, we stay away from yams, sweet potatoes, white potatoes, all of those different peas, corn, etc. All of those different starchy vegetables we stay away from. Very, very important. And if you're wondering, what can I eat, Pam? You're taking all of my favorite foods away. I've got lots of videos on what I eat. Number one, the eating plan, the Live Disease-Free Eating Plan. Number two, what I eat for breakfast, dinner, and supper. This topic today is going to give you lots of ideas too. So the key is that we are decreasing the carbs and we're looking for all the places that they're hiding, whether it's starchy vegetables, whether it's the grains, whether it is blatant in our face sugar that we're addicted to. So getting all those things down. Another thing that we really have to consider is dairy products. For many, many years, the hero doctors, the integrative healthcare professionals have understood that when you have chronic disease, you have to stay away from gluten products for sure, and dairy products. Why? Well, a couple of the possible reasons are that dairy products contain lactose, and some people are very sensitive to lactose, and lactose is a sugar. It is a milk sugar. So again, it is a carbohydrate. So when you even get lactose-free milk, they have used an enzyme to break it down into simple sugars. Some people are not tolerant. They don't tolerate lactose very well. So, but again, if it's breaking it down into simple sugars, we still don't want that. The biggest thing I believe with dairy is that the protein in dairy is very similar to the protein in gluten. And when we're sensitive to gluten, we're sensitive to dairy also. We do find that butter seems to be tolerated quite well, so that's fine. So again, sugars, grains, gluten, especially the gluten, but all the grains, starchy vegetables, and the dairy. And then the last thing that I wanted to share is where I see students that are implementing a lot of things really well, but it can still hold them back and make symptoms worse, is eating too many nuts. So in the Live Disease-Free Eating plan, we are allowed, and this is like especially in the recovery phase, we can eat a small amount of nuts and seeds per day, specific ones, not peanuts, not pistachios. The nuts that have a higher mold content, we avoid those. But things like eating too many, any of them, eating too many nuts per day, like if you're having a quarter cup, a half a cup, once or twice a day, eating them before bed, because our digestion really slows down before bed, and then we're not digesting them as well, and then again it goes down to the intestines where those critters are living, those ones that are giving us all the symptoms or a lot of the symptoms, and they end up feeding those infections. So I see that if people have too many nuts and seeds in a day, that it makes them feel horrible. So what I recommend is that if you are not allergic to nuts, if you're not sensitive to nuts, have a very small handful. So if you're a guy and you've got a big hand, just a very small handful once or twice a day. If you find that you're really addicted to nuts and you just like, I can't control myself, and there are people that I work with that are dealing with that, then what you would do is just get the nuts out of your eating plan for a while. Again, it also includes nut butters. Be careful, because a lot of times they'll add a little bit of sweetener to the nut butter. And when you're having a tablespoon of nut butter, it's like a much larger amount of nuts because it's all ground down. So again, nuts are harder to digest. And if you're really out of balance, which we call dysbiosis, you have too many parasites, fungus, bad bacteria, etc., in your gut, in your intestines, then when you eat a lot of nuts, your symptoms will be worse. And then the last thing that I just wanted to share with you is foods that you would be sensitive to. So when we have symptoms, maybe we're dealing with MS, or maybe we are like, oh, I just know something's wrong, maybe pre-autoimmune, and we know that leaky gut is a really big part of all of this, and we develop food sensitivities. There's a few reasons why we have leaky gut. The research is showing that glyphosate that's in Roundup really, really is devastating to the lining of our intestines, and it is a really big cause of leaky gut. But also the infections, when you have a lot of inflammation from parasites and fungus and bad bacteria, then the inflammation can cause leaky gut also. When we have leaky gut, then there are certain food particles that cross from the intestines into our bloodstream, and then our immune system is like, what the heck, this shouldn't be here, it's the enemy, and we can end up with being sensitive to certain things because we're developing an immune response to it. So the key is that if you are dealing with chronic disease, you may have some food sensitivities, and I wouldn't focus a huge amount on this. Like when I was first diagnosed, it was really popular for naturopaths to do some allergy testing and then desensitize you, and then you come back in 2 weeks and do some more sensitivity tests and then be desensitized, and you just keep going back and back, and the sensitivities change. And I would feel a little better when they desensitize you, but it was very short-term gain and very costly. When you heal the lining of the gut, very often what I'm seeing is people are not sensitive to a lot of different things they were in the past. But in the recovery phase, if you are, let's say, really sensitive to eggs, so I don't say avoid eggs, but if you know you're sensitive to it, or if you've been tested and you're sensitive to it, then you would definitely avoid foods that you were sensitive to, because it's kind of aggravating your immune system. And then with doing that, then you end up with more symptoms, and that can trigger or worsen how you're feeling right now. So again, I personally would avoid, and I forgot to mention too, when we're talking about starchy vegetables, but also dried beans and legumes. So we would avoid those two because they're very high in carbohydrates. And those carbohydrates, we don't digest them very well, but the microbes that are in our gut, the bad ones do, and so they will make us feel worse. So what we're doing is we're trying to eat foods that we're digesting more optimally, that are not going to have undigested carbohydrates reaching the area that we're going to treat, that we're going to knock back the parasites and the fungus, etc., and the bacteria. And then we start to notice, instead of our symptoms worsening, we start to notice like, oh my gosh, I I'm starting to feel better. My bladder is not bothered as much. I have more energy. I'm sleeping better through the night. I have more strength. And I'm going to share a couple of successes that just came in this week from a couple of students. I love sharing. This is why we do this. And this is the proof in the pudding. And then a couple of myths I wanted to check with. And if you guys have any questions, then I'm going to go and answer your questions. And if you're listening to the replay, make sure that you type in your questions, because we do answer them. I've got an amazing team of people that we're working together, and we will answer your questions. Myths. So with these saturated fats, you know, what I'm concerned about is when we have animals that are eating a lot of GMO feed, and we're having a contamination of glyphosate in the fat, etc., that is a concern to me. But saturated fat on its own and red meat, I like working with over 600 people, I have not seen any evidence that that is a concern. Actually, when we're decreasing the carbs, some of us that are really sick, we're skinny. Like I was always slim, and I couldn't afford to lose weight. So we have to up the healthy fats. And we're switching our body to be more of a fat burner than a sugar burner, and people notice huge, huge improvements with that. So again, going low carb and higher fat to maintain our weight is what is helping people to recover because of the cause. When infections are causing your symptoms, causing the inflammation, and you start to decrease the food that feeds those infections, then you're avoiding the foods that would feed them and make your symptoms worse, right? You're going to notice that you're going to feel a lot better. And that is the key. That is why this works so well. So it's not total theory. It is really what the cause is. And how do I know what the cause is? Well, watch some of my other videos. Go onto the livediseasefree.com/MS-infections. I've shared on that page tons of research. I've shared tons of videos on MS and linked with infection. I've shared pictures of worms that our students are passing. I've shared research from Dr. Alan McDonald, finding so many nematodes, tiny little worms in the spinal fluid of MS patients. And when those nematodes are present in animals, they have all of the symptoms of multiple sclerosis. And the veterinarians have known this for 100 years. Don't ask me why nobody's ever made the link between it. It's ridiculous, because we know that these parasites can be passed on to humans. So the key is that if you want to make sure that you are not triggering symptoms, making them worse, bringing on new symptoms, then you have to stop feeding what is causing your symptoms. And then there was one other thing that I wanted to mention. Maybe it'll come to me. Oh, yes, avoid certain, I just wanted to throw this in here with respect to drinks also. So we know that there's a lot of health concerns about aspartame, especially when you mix caffeine with aspartame, it can really do damage to our neurons. So make sure you're not having any aspartame. There's some really lovely sparkling waters that have no sugar, no sweetener, no aspartame, and they have an essence, a natural essence of some kind of a fruit, whether it's cranberry, raspberry, or peach, pear, whatever, but they're very flavorful. You can take different herb teas and you can chill them and put them in your fridge, add a little squeeze of lemon to it. So it's really important to avoid aspartame. It's really important to avoid caffeine. There is research showing that when MS patients and autoimmune chronic disease remove caffeine, that a lot of them notice that they're feeling a lot better. Think of it this way. If you have a lot of parasites in you and you're taking caffeine because you want to boost your energy, can you imagine what these tiny little worms are doing when you're giving them a good shot of caffeine? Right. You can see why they are going to worsen your symptoms. Simple as that. There's lots of other reasons, right? Because our adrenals are taxed when we have these infections, and the caffeine is not doing your adrenals any favor. And then things like coffee is acidic, and we end up being more depleted in minerals, and we already are when we have the infections because there's so many acids produced by the infection. So there's lots of reasons to avoid caffeine while you are recovering. And then when you've recovered, you decide if you want to bring it back in. I don't drink caffeine. You'll have so much energy. You won't need the ups and the downs, and you won't need that terrible headache if you decide not to have it again. And then things like MSG is brutal. So make sure to avoid MSG. That can definitely trigger symptoms, and aspartame. And then there is alcohol. And yes, it's hard to give alcohol up at front. And some of us have to have a really big reason to give it up. I had a very big reason. My reason was I wanted to live. I was not going to end up in a wheelchair. I was going to do whatever it took. We know that alcohol is a carcinogen. Your liver has to break it down. It's a chemical that can lead us towards cancer if we have a lot of it. And we also know that certain alcohols like wine and beer are loaded with yeast because that's how they're fermented, that's how they're made. And we know that there's a huge fungal component in multiple sclerosis, not just Candida. What I'm seeing is a lot of my students are testing really well for using other antiparasitic treatments that will kill aspergillus and mold also. So it's really important to understand that when your body is full of organic acids from these yeasts, and it's also full of all these fungal components and your immune system is overwhelmed, don't put more yeast products in your body. It's just going to make you feel a lot worse. Very important. All right, I'm going to go to your questions and see if you have any good questions here for me. Hi, Rudy and Roberta and Tina. Hi, Marlene. Hi, Anthony. Hi, Dawn. Hi, Deborah, Margaret, Marie. Hi, Carlos. Hi, Allison. Hi, Carlos. Debbie. Okay, here's a question. Debbie, why? Oh, awesome. Thanks for sharing. She just shared. Facebook friends, please watch this video. It's very important for your health. It really is. Your mobility is everything. It's your independence. And when you avoid foods that make your symptoms worse and you start to feel a little better, it helps you to buy into this and understand that this is for real. And it helps, but you ultimately have to treat infection to get your life, to get the most recovery. You have to physically remove these bad disease-causing microbes from your body. You can't probably sterilize yourself, but you can knock them back so far that you become symptom-free of whatever you're dealing with, and then you manage it for the rest of your life. And that's how I've been able to live 30 years MS-free. Hi, Alexander. Hi, Dana. Andrew. Hi, Anitra. So Roberta is asking, what about sugar substitutes like stevia and xylitol? So, this is where there's several things to this. Number one is that when we have a sweet tooth, it's hard. When we see other people eating sweets, it's like we want that. And there is risk of caving and giving into it and falling prey to that and then building up those infections in your body again. So the key is that at the start, when we start making these shifts, we're thinking differently that when we're in the phase of recovery. And once our taste buds start changing and we find that the Live Disease-Free Eating Plan is so tasty and so refreshing and you feel so much energy when you're done living that way, and your taste buds change and you don't, like for myself, I haven't had sugar for so long. Could I eat sugar? Yes. Would I enjoy it? No, it's so sickeningly sweet. And that's what you'll find in time. My husband bought some of those sparkling drinks that have 0 calories and no sugar, and they have xylitol in it, or no, stevia. It has stevia in it. And stevia has a very strong taste. And I used to love root beer when I was a kid. And he bought this root beer one. And I took a sip of it, and it is just disgusting. My grandkids wouldn't even drink it either. So it's like, I'm still working on my husband. He's really good. Like, he doesn't eat a lot of carbs, etc., but he still has that underlying sweet tooth. So if you keep feeding your sweet tooth, you're going to keep your sweet tooth and you are going to cave. If you just change your taste buds and you're not eating sweets, unless it's a really good piece of fruit, especially once you've recovered, we're getting into peach season, and I have been known to eat, a couple of good sized peaches at a time, absolutely, first thing in the morning still. But the key is that make sure that, and I don't do that all the time, it's just, when they're in season for a couple of days, I'll do that. You just have to understand that if you keep having these sugar substitutes, you're going to keep your sweet tooth and you're going to keep the cravings, and it's going to be hard for you. When you get rid of them and you just let your taste buds adjust, then you're not going to like it and you're not going to want it. That's the key. And there are some substitutes that have sugar hidden in it. And so be very careful. You're not going to go back to the evil sugar, Debbie. That's awesome. And Stephanie, yes, sugar. You guys all got that answer when I was asking. Hi, Michael. You got the right answer. So all the grains, and we're living in a time where a lot of the grains that we're eating, like wheat, they're different than the varieties we had years ago. And when they are digested in our body, they convert to a lot more sugar. They're less protein and more sugar. It's really significant. And again, you might not know this, but a lot of the wheat crops, they are not genetically modified, but they are spraying Roundup on the wheat crops to ripen them, so they ripen and die at the same time, so they can harvest them easier and have a better crop for harvesting. So there is residues of glyphosate in our wheat, and then of course in our sugar, because sugar is from sugar beets very often, and those are genetically modified. So glyphosate is almost everywhere. So as you can, try to work towards organic so that you can try to avoid it. Little point here, if you're having supplements, make sure that your capsules are not made out of gelatin, because they are contaminated with glyphosate also. Glyphosate is brutal. There are some lawsuits that are coming out now. They told my dad for years, oh, it's so safe, you can drink this stuff. Nothing but lies. And so now all of it is coming out, and it's just brutal. You wonder why in the restaurants there are all these large parts of the menu that are all gluten-free. It has really been a big factor in the leaky gut and gut impairment for a lot of people. I don't know about cassava root, if that is, it could be, sorry, that's something that is not really commonly talked about in our group, but you're always thinking of awesome things. But I would just get used to having things that don't taste sweet. And I promise you, your taste buds will change. And I promise you, it is so worth it, because it's called freedom. I am free. I am free to eat so that I'm incredibly satisfied. Like this week, it was my birthday, turned 58 years old. And my son-in-law, Chris Barton, he is an amazing chef, and he is creating a cookbook for us. And he made this amazing meal for my birthday. My family was all together, and I was so satisfied. So the thing is, when you eat this way, you're so satisfied because you have all these beautiful flavors from all these different herbs and mixing different healthy foods together. And you don't feel sick after, and you feel really good. You could go for a walk, you can do whatever, and you don't have that terrible slug feeling, and you don't have any symptom flare-up. So I just wanted to quickly share before we're done here a couple of successes that just came in this week, because this is why I do what I do. This is what makes me so excited. One student shared, since I've completely come off of caffeine, I don't have any more urinary accidents, and my tachycardia episodes they're almost gone. That is just with the eating plan, with making sure to avoid these triggers that I just talked to you about. And then another student, this is really big. So this student has been following the eating plan, making sure to avoid all those triggers, supporting the body, just starting to treat infections, not in the full treatment yet, but she shared, I'm healing and it feels so wonderful. I'm crying happy tears as I type this. I enjoyed my best day so far, yesterday. I was able to enjoy a day full of activity that included a 4-hour shopping trip and still had energy to end the day. My mobility continues to improve. My overall attitude is better. I'm more resilient. My cognition is improving. I'm able to walk so much better. It goes on. My movement is better, and I'm able to feel and use my core muscles with much greater control. I'm more aware of myself and the world around me, and I'm enjoying every day more and more. My friends and family are noticing and commenting. I am so encouraged. I still have lots of work to do. I'm looking forward to beginning my first round of treatment this week. I'm beginning to feel alive again. My bladder function continues to improve. I'm continuing to eat well and enjoying the Live Disease-Free Eating Plan. I'm so thankful for all this information. I've known about parts of this, but now over the past 20 years, she's been putting all the pieces together. But I'm grateful to see the progression and compilation of everything here in this program. So excited for her. And then the last one, this is a student that just joined 2 weeks ago at the most. She shared, "Hi Pam, I'm learning so much about my body. I was already eating pretty clean, but I now notice when I eliminated those hidden sugars, my energy level has improved. I have less bladder issues and I'm sleeping so much better." In 1 week, she had the symptom improvement. So that is the key. When you avoid the triggers and you follow the eating plan even more closely, we see huge changes and shifts in people's health. She shared, "This is huge for me. And I've also noticed my allergies and my sinus issues are improving." This is in 1 week. How exciting. So these are wellness champions. These are people that are working with me in the Live Disease-Free system. If you are somebody who is like, "I'm dealing with really scary symptoms, maybe a diagnosis, or I'm just kind of worried that I'm going down a wrong path, that I could end up with chronic disease." If you're any of those people, make sure to watch my videos. I've got tons of videos that are really specific, lots of content as far as what really works. And we're seeing like life-changing experiences, not just with people that are dealing with MS, but people that are correcting infertility and arthritis and pain going away and all kinds of, diabetes, getting off of all their medication, and it goes on and on. PLS, we had our first student, PLS, which is like ALS, a slower progressing version of ALS, and she is super fired and doing so amazing. So if you're at that place where you're just like, "Pam, I'm a little skeptical," go watch my videos, implement, and then let me know when you're improving. Then when you're ready to start treating, maybe some of you have been like, "Pam, I've been spending a lot of money with integrative practitioners. I've been doing all kinds of functional medicine things. I've been using CCSVI, stem cell therapy, whatever. I'm ready for a plan. I want to treat these critters. I want to get them out as soon as possible." Make sure to watch my master class training. You can watch it, and if you're ready, then you can join us and you will chat with me. I want to get to know you about your health history, etc. You can literally start this week. So wherever you're at, I want to support you. I want you to live your best life. So I'll just see if there's any last questions. So Diana, no sugar, grains, nuts, starchy vegetables. How do I find out what to eat? Again, I shared on several other videos. Oh, and I also have a book, Become a Wellness Champion. You can find it on Amazon or Barnes & Noble. You can find it on my website, livediseasefree.com. So you can eat lots and lots of low-carb vegetables. There's a huge number of them. You can eat healthy fats. You can have animal protein. You can have a little bit of fruit, just very limited until you have really knocked back those infections. But those are the biggest categories of what we eat. So there's all the fresh herbs and spices, and the healthy fats bring flavor into the food, and you can have animal protein and lots of vegetables, just the low-carb vegetables. So that's what you can eat, Diana. Andrew, what about raw almonds? Again, raw almonds are really healthy, but they are harder to digest and they are higher in carbs. So again, with all of the nuts and seeds, in the recovery phase, we're having just a very small amount, once or twice a day. If you eat a quarter cup, half a cup, once or twice a day, several tablespoons of nut butter, you'll find that it makes your symptoms worse because you're feeding the infections. And again, just make sure you're not allergic to any foods, but otherwise nuts are healthy in a very small amount until you have recovered. So we don't do any baking with nuts, almond flour, coconut flour. We're eating foods as close to its natural state as possible because we have a big task. We want to recover from these incurable diseases. So we have to stop feeding the infections. Then what we do is we support the body in various ways, and this is all in the Live Disease-Free system. When you watch my masterclass training, I talk about all the steps of following the eating plan and then supporting the body, and then we look at our symptoms and we make a game plan to treat. And the treatment is really serious. It's like we're using antiparasitic drugs, herbs, we're layering different therapies, oxidizing oxygen therapies. And we are finding quicker and quicker ways for people to recover. And it's so super exciting. Hi, Allie. Yeah, so gluten mimics something that the body attacks itself. What about dairy? So I talked about that. The protein that gluten is a protein, and that protein is very similar in structure, very, very similar in structure to the dairy protein, the protein in dairy. So if your body is attacking the gluten, then it will attack also, it could attack the dairy. So that's one theory. We don't know exactly all of it. It could also be the sugar that's in the dairy products, but all we know, and we've known this for 30 years since I was, treating candida years ago, the very first things I found was to avoid all dairy and all gluten. And now we're avoiding all grains, and it's really helping people to feel so much better, quicker. Hi, Kim. So are you going to tell us which foods are good for us? Yes, I just did. You're very welcome. And there's videos that I have also just on YouTube. So YouTube, Live Disease Free channel. Make sure to subscribe if you enjoyed what I taught you and you want to learn more and you want to make sure you don't miss any of the trainings. Live Disease Free channel on YouTube, and also Live Disease Free on Facebook page. Hi, Lisa May. Lisa May we've got lots of wellness champions on here. She is actually someone who corrected her infertility and beat her MS. Really exciting. And Allison, does coffee literally poison the nerve? It's not a nerve toxin. I wouldn't say that, but it definitely is hard on your adrenals. And when we have chronic infections, our adrenals are very often taxed. We can have adrenal fatigue. It's very, very common in chronic disease. So with the high stress life, et cetera, and then also these infections producing all these different chemicals, our adrenals can become exhausted and we can end up with low thyroid and all kinds of other things. So the key is that when you get rid of the caffeine, it's not wiring up the parasites. It's not stressing out your adrenals, and it's acidic, so it's not going to be burning up extra minerals that you're deficient in already. There are very many reasons to come off of caffeine and coffee also. And then organic decaffeinated, you have to understand there still is caffeine in decaffeinated coffee. Not as much, but there still is. And again, that will be still a very acidic beverage. Hi, Denise. Hi, Diana. What book can I buy for the recipes? It's coming. We've never done a cookbook before. We're hoping it'll be ready by Christmas time. We'll keep you guys posted. Right now, we're just in the testing. We've got all the recipes in place and we're just testing. And then we're going to get a publisher, and then we are going to get it put together and printed. So again, we're hoping for just in the new year, but we will keep you posted. Complete, and yeah, I would definitely go off of all of the decaffeinated coffee. If you're just finding me and you're like, okay, that sounds like I want to do that, but I don't want to get, big headaches and big withdrawals, what you can do is you can take your caffeine coffee and you can dilute it with decaffeinated coffee and kind of work it down that way. Because I know some people get terrible headaches when they're coming off of caffeine. You're absolutely right, Roberta. Organic coffee, decaffeinated, still has caffeine in it. And yes, you found out the hard way yourself. Way to go. I mean, not good that you did it, but I'm happy that you found that out. The key is that you have to understand that coffee is an addictive substance. So is it that it's really, really, really good, or is it that we crave it because we're addicted to it? And I think it's the latter. Because if you're a healthy person and you just go to decaffeinated coffee, you're not going to enjoy it as much. You're not going to probably stick with it. You'll either go back to the caffeinated coffee or you will stop because it kind of leaves this bitter taste in your mouth. So I love freedom. I almost lost my life. When I was 28 years old, I was told that I was going to end up in a wheelchair. It was hitting me so strongly, I honestly don't think I would be alive today. So for me, I have so much energy, and it's like I gave up alcohol years ago. I don't miss it. I'm free. And being free and living your best life, especially when you almost lost it, is priceless. Oh good, Stephanie, you're not drinking any alcoholic beverages? Yes, I used to love a glass of wine, but it's just not worth it, especially what I'm passionate about is changing the world. So I have to put a lot of energy into that. And I want to just be really living by example, but also reserving as much energy as I can. How do you tolerate die-off when it makes the nervous system shake? So this is, Jordana, I don't know anything about you. You have to work with someone. You have to make sure that you're working with someone who understands. So there's several reasons for stronger symptoms. Well, number one is, like I said, you're eating whatever we shared today, your symptoms can be stronger if you're eating these foods. Number two, if you're using a treatment that is not effective for the infection that you have, but it's aggravating it, making it angry, you can have worse symptoms. So it might not be die-off, it might be that you're not using the right treatment. But then too, sometimes if you are using the right treatment, if it kills it off too quickly, you could also have a die-off reaction. But that's not as common, because we're seeing actually that the drugs are tolerated really well for treating the parasites, et cetera, and people are not, most of them are not having those reactions. It has more to do with if you're using something that is not really effective for the critter that's giving you the most grief, and it more aggravates them and makes them angry, then you have those symptoms. But that's where, if you're taking a treatment and you're working with someone and it's not working for you, you always stop. That's our golden rule in our Live Disease-Free system, is listen to your body. If something is not working, you stop and you recover, which takes 1 to 3 days. Then you have to work with, that's what I help people do. I help you figure out, okay, like, is it that you're not using the right treatment? Is it something from your eating plan? Maybe you're eating these trigger foods and you're making your symptoms worse. The treatments are not strong enough on their own to really do justice to getting your life back to level right now at this time. It probably has to do with that we are using higher doses, safe doses that are recommended by certain hero doctors in the program, but it might be that a 30-foot tapeworm is going to require more than what we're even using, but that's why we have to use several different approaches together. So when you're treating infections, you have to work with somebody, Jordana. You really have to, and it's worth it. So make sure if you're ready, reach out to us. Later on, reach out to us by watching my masterclass training. Hi, Maureen. Hi, Marlene. Hi, Kelly. Couple last questions. Thank you. Actually, it's 58. Oh, Stephanie, I turned 58 years old. I said to my husband the other day, I said, in 10 years, we're going to be getting close to 70 years old. Like, how does that happen? I don't know. I'm not sure. Yes, hurry up, Chris. I'll tell him that. I will definitely. Yes, we need the cookbook. I promise you'll be good. And actually, if you're in our inner group, the Wellness Champions, you're going to do a little bit of recipe testing for sure, helping us out there. So you'll get some little insights before it's out. Yes, Chris, hurry up. Yes, I'll tell him. I'll let him see all the comments. Absolutely. Okay, I'm going to let you guys go. You're very welcome, Starlina and Catherine. What do I feel about the big hype of celery juice? You know, celery juice is, oh, that's what I wanted to share. I'm going to talk about salt. There's some studies, or one study that came out saying that with multiple sclerosis, that salt can actually aggravate your symptoms. I really don't buy that. It's like one study, and you have to have multiple studies. So again, what we're seeing is when you eat a low-carb eating plan, then you have to make sure that you're having a little bit more salt, because we go through salt more for whatever reason. So if you're following the Live Disease-Free eating plan, or you're on a keto diet, just salt your food. Just comfortably make sure you're salting food, and don't avoid it. Salt is super, super healthy. It's really good to have sea salt or Himalayan sea salt, where it has all of the little specks of all the different minerals in it, for sure, really important. So I personally don't believe that I eat salt. I never avoid salt. I don't like go crazy on it to the point where I'm drinking gallons of water, but I have a good amount of salt on my food. And I honestly, with 600 students, with what we're doing, with the results we're seeing, it's not an issue with salt. Going back to the celery juice, it's not going to be harmful, all right? It's definitely not going to be harmful. People notice some little bit of benefits. It really depends where you're at. If you're really out of balance, you just have to understand it's kind of like doing, because there's not a lot of sugar in it, so that's helpful. I wouldn't do like a bunch of carrot juice when you're dealing with chronic disease. Carrots are really good, but it's concentrating the sugar. But with the celery juice, you're literally going through 2 big stalks a day to get the amount of celery juice that you need. And I've talked to some people that, thanks for all the love, and what I've talked to people that have done it, and it's kind of made them feel sick. So they had huge, not MS, but they have huge parasites, and they're doing celery juice thinking that, like, they don't understand how many parasites they have, but they're thinking the celery juice is going to fix them up. It isn't. It'll be like kind of like a juice cleanse for a little bit of time. It will not heal MS. It will, like, even the antiparasitic drugs and herbs we're using combinations of things. They're 10 times more strong. And again, the celery juice is just going to touch your GI tract. By the time you have any type of autoimmune disease, those infections are throughout your body. And if you have neurological symptoms, you're ending up with infection in your central nervous system. And so the celery juice is not going to touch that. So just be aware that when you're super healthy and you've knocked back all these infections and you want to do like a little water fast. I did a talk, I think last week or the week before, about fasting. If you want to do a 3-day fast, or you want to do a 1-day water fast, or you want to do a celery juice, go ahead and do it then. But don't expect that it's going to treat the infections that are making you disabled. And you might feel really awful, because if you just go cold turkey, and I can't remember the celery juice, I think you're just drinking a glass, but you can still eat. They're trying to get you to eat healthier, but it's not gonna get rid of MS. It's not gonna treat those infections, whether it's Lyme disease and big worms, small worms, it's not gonna do it, just so you know. Yes, make sure to check your gelatin or your capsules, Denise. You know, it depends. You don't have to throw them out. You could open them up. So I had some plant enzymes that I was using. And so what I would do is just open up the capsule and put the enzymes on a spoon and put it in my mouth. So just avoid the gelatin capsule part. Hi, Jules. Hi, Matt. Celery juice is not going to be harmful, but it's not, it just depends. If you have serious chronic disease, then you will see more benefit by following the Live Disease-Free Eating Plan, by watching my videos, reading my book. And then once you start to feel a little better, then make sure that you look us up and watch my free training and start to treat infections. That's where you see the biggest improvement in your health and your quality of life. Thank you for the compliment. It's all the vegetables. So Harvinder, I shared which foods to eat. Just listen to the replay of this or watch my other videos. What about sunflower seeds? Again, a little bit of sunflower seeds is absolutely fine, just a small amount. And when I say a small amount, it's like a very small handful, maybe 1/8 of a cup of seeds once a day kind of thing, absolutely fine. Hi, Jennifer and Ronnie and Matt. Yeah, I know there's a lot of people praising celery juice, and I guess organic celery has gone through the roof as cost. Some people can't get it. Like I said, when you're really healthy, you can do all of these little things to up-level your health, like doing a fast or doing the celery juice, but don't expect, like, it's a short-term thing. It's like a little bit of a purge cleanse kind of thing, and it's not going to treat the infections that are causing your symptoms. It's not strong enough for that. Celery is healthy, but it's not strong enough to reverse chronic disease on its own. So with that, next week, what am I talking about next week? Oh, next week I am talking about, I have it here somewhere. Yes, popular MS diets. I'm going to compare a lot of the very most popular multiple sclerosis diets, the pros, the cons, so that you guys can understand better what is most helpful for you. With that, I'm going to let you guys go. Take care and bye-bye for now.